வணக்கம். அனைவருக்கும் வணக்கம். உலக அமைதி, ஒற்றுமை, மன அமைதி, சமாதானம், ஆரோக்கியம் ஆகியவற்றினை முன்னிலைப்படுத்தி நடத்தும் ஒரு சக்தி வாய்ந்த கூட்டு தியானத்தில் கலந்து கொண்டிருக்கும் அனைவருக்கும் உலக அமைதி நல்லிணக்க குழு PSSM தமிழ் ஐரோப்பா சார்பாக ஒரு இதயபூர்வமான நன்றியை தெரிவித்துக் கொள்கின்றோம். இன்றைய நிகழ்ச்சி முதலில் எங்கள் தியானம் பற்றிய சிறு விளக்கம், தியானம் எவ்வாறு செய்யப்படும் என்று கூறப்பட்டு ஒரு அருமையான இசையுடன் 25 நிமிடங்கள் தியானம் நடைபெறும். அதனை அடுத்து நமது பிரதம சிறப்பு பேச்சாளர் டாக்டர் மதியழகன் அவர்கள் இன்று பேச இருக்கும் தலைப்பு கல்லீரலில் கொழுப்பு அது எப்போது முக்கியம் என்ற தலைப்பில் அவர் பேச வருகிறார். இப்பொழுது தியானம் நடைபெறும். நன்றி, வணக்கம்.
அனைவருக்கும் வணக்கம். இப்பொழுது நாம் தியானம் ஏன் செய்ய வேண்டும், தியானத்தால் என்ன நன்மைகள் என்று சிலவற்றை கூறிவிட்டு தியானத்திற்குள் செல்வோம். நாம் பிறந்த நாள் தொடக்கம் மூச்சு என்பது எம்முடன் இருக்கின்றது. அந்த மூச்சை நாம் கவனிப்பதில்லை. அதை நாம் விழிப்புணர்வுடன் கவனிக்கும் போது அது தியானமாக மாறுகின்றது. இத்தியானம் செய்வதால் எங்களுக்கு பல நன்மைகள் கிடைக்கின்றது. எத்தனையோ விதமான நன்மைகள் கிடைக்கின்றது. அத்துடன் நாங்கள் விழிப்புணர்வுடன் ஒரு வேலையை செய்யும் போது நாம் எடுக்கும் தீர்மானங்கள் எல்லாம் இலகுவாக எங்களுக்கு எடுக்கக்கூடியதாக இருக்கும். பதட்டம் இல்லாத நிலை இருக்கும். மற்றது பல நன்மைகள் கிடைக்கும். எங்களுக்கு ஆரோக்கியமான வாழ்க்கை வாழக்கூடிய நமக்கு நோய் எதிர்ப்பு சக்திகள் கிடைக்கின்றது. இப்படிப்பட்ட ஒரு தியானம் மிகவும் இலகுவானது. 5 வயது சிறுவன் முதல் பெரியோர் வரை எவரும் இலகுவாக செய்யக்கூடிய தியானம். ஏனெனில் இந்த மூச்சை கவனிப்பது தான் தியானம். இப்பொழுது நாம் தியானம் எவ்வாறு செய்வது என்பதை பார்ப்போம். தியானத்திற்கு முன்பும் பின்பும் இளம் சூடான நீர் அருந்துவதால் தொண்டை வறட்சியை தடுக்கலாம். ஒரு சுகமான ஆசனத்தில் அமர்ந்து கொள்ள வேண்டும். தரையில் இருப்பவர்கள் சமணங்கால் போட்டு அமர்ந்திருக்கலாம். நாற்காலில் இருப்பவர்கள் முதுகுத்தண்டு வளையாது நிமிர்ந்திருக்க வேண்டும். நிமிர்ந்திருந்து கொண்டு கால் பாதத்தை இவ்வாறு ஒன்றன் மேல் ஒன்றாக வைக்கின்றோம். ஏனெனில் கால்களினூடாக 10% சக்தியை நாம் இழக்காமல் இருப்பதற்கு இவ்வாறு கோர்த்து வைக்கின்றோம். கைகளை இவ்வாறு கோர்த்து மடி மீது வைக்கும் போது இன்னொரு 10% சக்தி எமது உடலிலிருந்து நீங்காது இருக்கும். கண்களை மிருதுவாக மூடும் போது 80% சக்தியையும் நாங்கள் உள்வாங்கின்றோம். கால்களை பின்னி கைகளை கோர்த்து கண்களை மூடி நாம் எமது உடலில் இயல்பாக இயங்கிக் கொண்டிருக்கும் உள்மூச்சு வெளிமூச்சை கவனிக்கும் போது எண்ணங்கள் வந்து கொண்டிருக்கும். எண்ணங்கள் வரும்போது அதை விடுத்து மீண்டும் மீண்டும் எமது மூச்சின் மேல் கவனத்தை செலுத்தும் போது எம்மை அறியாமலே எமக்கு ஒரு அற்புதமான சக்தி உள்ளுக்குள் எம்மை கொண்டு நடத்தக்கூடிய ஒரு ஃபீலிங் எங்களுக்கு கிடைக்கும். ஏனெனில் எங்களுடைய எண்ணங்கள் குறைய 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 எங்களுக்கு நல்ல ஒரு சக்தி கிடைக்கும். எனவே எப்படிப்பட்ட ஒரு அருமையான தியானத்தை நாம் இப்பொழுது 25 நிமிடங்கள் இசையுடன் செய்ய போகின்றோம். மூச்சை கவனிக்க முடியாதவர்கள் இசையை கவனித்த வண்ணம் கண்களை மூடிய வண்ணம் அமர்ந்திருங்கள். அறிவித்தல் வரும் வரை கண்களை திறவாது மூச்சை கவனிக்குமாறு அன்புடன் கேட்டுக்கொள்கின்றோம். நன்றி, வணக்கம். நிலைக்கு வாருங்கள். இப்பொழுது உங்கள் கைகளை பிடித்து கண்களில் ஒற்றி வைக்கவும். 5 வினாடிகள். 1, 2, 3, 4, 5. இப்பொழுது உங்கள் கைகளை பிடித்து உள்ளங்கைகளை பார்த்து நாம் ஒரு அருமையான தியானம் செய்ததற்காக இறைவனுக்கும் பிரபஞ்சத்திற்கும் நன்றியை கூறி கைகளை தட்டிக் கொள்வோம். நன்றி, நன்றி, நன்றி.
நன்றி. பிரபஞ்ச சக்தியின் நல்லாசியுடன் நாம் அனைவரும் ஒன்றிணைந்து மன அமைதி, சமாதானம், ஆரோக்கியம் ஆகியவற்றினை முன்னிலைப்படுத்தி ஒரு சக்தி வாய்ந்த கூட்டு தியானம் செய்தோம். நாங்கள் எமக்காக செய்யும் தியானம் கூட்டாக செய்யப்படும் போது அது ஒரு சமுதாய சக்தியாக உருப்பெற்றி வீடு, வீதி, எங்களது சுற்றாடல், நகரம், நாடு, உலகம், பிரபஞ்சம் என்னும் அளவில் விரிவடையும் வலுவுடையது. இத்திய தியானத்தில் ஈடுபடுவதற்கு அனைவரையும் ஊக்குவிப்பதோடு அதற்கான வசதிகளை ஏற்படுத்தி கொடுக்கும் உலக அமைதி நல்லிணக்க குழு PSSM தமிழ் யூரோப், PMC தமிழ் டிவி, YouTamil TV ஜெர்மனி ஆகிய அமைப்பினர்களுக்கு நமது இதயபூர்வமான நன்றியை தெரிவித்துக் கொள்கின்றோம். வாழ்க வையகம், வாழ்க வையகம், வாழ்க வளமுடன் என்று மனதார வாழ்த்தி, உலகத்தில் சமாதானம், நல்லிணக்கம், அமைதி, ஆரோக்கியம், ஒற்றுமை ஏற்பட வழிவகைகள் செய்வோம். உலக சமாதானம் ஓங்கட்டும், உலக மக்களின் மனதில் அமைதி நிலவட்டும். இன்று மிகவும் சிறப்பாக தியானத்தை வழிநடத்திய அருந்ததி ஸ்ரீகாந்த ராஜா மாஸ்டருக்கு முதலாவது நன்றி. இந்த நிகழ்ச்சியை டோக்கிங் சரையிலிருந்து ரெக்கார்ட் பண்ணி கொண்டிருக்கும் பவானி விக்னேஸ்வரன் மாஸ்டருக்கு நன்றியை தெரிவித்து, மற்றும் ஃபிளையர்ஸ் மற்றும் பல விடயங்களில் ஈடுபட்ட எல்லோருக்கும் நன்றியை தெரிவித்து இப்பொழுது நாங்கள் அடுத்த நிகழ்ச்சிக்கு செல்கின்றோம். இன்று அடுத்ததாக நிகழ்வு இருப்பது ஒரு அருமையான பேச்சு. நமது தளத்தில் முதன் முறையாக உரையாற்ற வருகின்றிருக்கும் டாக்டர் ராஜரட்னம் மதியழகன் அவர்களை அறிமுகப்படுத்துவதில் நான் மிகுந்த மகிழ்ச்சி அடைகின்றேன். இவரை எங்களுக்கு எல்லோருக்கும் தெரிந்த டாக்டர் ரஞ்சதயாளன் அவர்கள் அறிமுகப்படுத்தியிருந்தார். அவருக்கு நன்றியை முதல் தெரிவிக்கின்றேன். டாக்டர் மதியழகன் மானிப்பா இந்து கல்லூரியில் கல்வி பயின்று யாழ் பல்கலைக்கழக மருத்துவ பீடத்தில் பட்டம் பெற்றவர். பின்னர் இங்கிலாந்துக்கு வந்து ஆக்ஸ்போர்டில் அமைந்துள்ள ஜான் ராட்கிளிஃப் மருத்துவமனையில் மேற்படிப்பு பயிற்சி பெற்றார். அவர் இரைப்பை குடல் இயல், கேஸ்ட்ரோஎன்டராலஜி மற்றும் பொது மருத்துவம், ஜெனரல் மெடிசின் ஆகிய 2 துறைகளிலும் நிபுணத்துவ சான்றிதழ் பெற்றுள்ளவர். கடந்த 25 ஆண்டுகளாக நார்ஃபாக் குயின் எலிசபெத் மருத்துவமனையில் கன்சல்டனாக வேலை செய்து கொண்டு வருகிறார். இப்பொழுது இன்று பேச இருக்கும் தலைப்பு கல்லீரல் கொழுப்பு, அது எப்பொழுது முக்கியம் என்பதை பற்றி அவர் பேச வருகிறார். டாக்டர் மதியழகன் ஐயா, இப்பொழுது இந்த தளம் உங்களுடையது. நீங்கள் உங்களுடைய பேச்சை ஆரம்பிக்கலாம். நன்றி.
Thank you for this kind invitation, and also I'm very grateful to Dr. Rajaratnam for introducing me, and also for those kind words of introduction. First of all, I would like to extend a very warm virtual welcome to all the participants, whatever the time zones they are in, because I know there are a few people from Australia and Canada as well. நீங்கள் எந்த நேர வலயத்தில் இருந்தாலும் எனது மனமார்ந்த நல்வாழ்த்துக்களையும் வரவேற்பையும் தெரிவித்துக் கொள்கிறேன். Today we are going to talk about, let me share my slides, see. Right, okay. Bear with me, I hope the technology works. And, okay. Are you able to see my slides?
Yes, we can.
Okay, yeah, thank you very much. So today we are going to talk about something that affects 1 in 4 adults. Yet most people have never heard of it, never felt it, never been warned about it. Yes, we are talking about fat in the liver, or fatty liver, or in medical terms we call it hepatic steatosis. By the end of this talk, I want you to walk out knowing 3 things: what is fatty liver is, and whether you are at increased risk or any risk factors, and most importantly, what you can do about it. Let me start with the statistic that surprises most people. 1 in 4 adults in the world has got fat in the liver. And interesting, and perhaps in this room, I would think several of you may be having fatty liver. But here is the thing. Most of them feel absolutely nothing, no pain, no tiredness, no warning sign whatsoever. And that is why it is also called silent condition. But the encouraging part is that if we caught early, fatty liver is completely reversible. If it not managed or controlled, that can lead to a chronic liver disease. And we will talk about that in subsequently. So let me also talk about, spend some time about how remarkable the liver is. sitting under our right rib cage, roughly the size of a rugby ball or maybe a small jackfruit. It weighs about 1.2 kilograms, and it does about more than 500 functions a day. And if you look at those functions here in these slides, it filters our blood and also detoxifies drugs and harmful substance and alcohol, and also produces bile to break down fats. It stores glycogen as energy source, and also it makes protein factors. When in injury, it makes the blood clot. So it does a lot of functions and a very important organ. And it is the largest organ in the body. And I'm sure Dr. Ranjit Dalan would say the heart is probably the most important organ, but I'm not going to argue. I'm just saying the liver is the largest organ in the body. Right, so let's talk about what exactly fatty liver is. So if you look at the fatty liver, I also have got a picture. I think on your left is the normal looking liver, which is a deep reddish brown color, smooth and firm texture, and it contains about less than 5% of the organ weight. That is the normal content of the fat, and it functions well. Whereas the fatty liver, which you can see, it's a pale yellow or greasy looking color, enlarged and soft, and it contains more than 5% of the organ weight. But it can go up to 20-30% depending on the degree of fatty liver. But it is like, the analogy is probably building up grease in the kitchen pipe. So in early stages, the water flows well, but subsequently when the grease builds up and it fails, and when it's completely clogged up, and the liver then will lead to reversible damage. Then this is an interesting part. I just wanted to show you this picture because that is an important part when it comes to fatty liver. This picture was taken by the RSPCA members, where a duck or a goose is force-fed about 10 to 15 times more than what they require daily by putting an iron rod into the gullet to produce fatty liver. In French term, it's called foie gras, which is a delicacy in France. About 20,000 goats or ducks are sacrificed every day. Very popular in North America, perhaps in Europe as well. So perhaps this is one of the reasons that is in most of the time when the fat develops in the liver, it is probably that we are eating more than what we need. So I want to reassure you, this is not to talk about alcohol-related liver disease. We are talking about a completely different condition. That is what, in the past, before 2023, it was called non-alcoholic fatty liver cell disease, NAFLD. You'll probably be familiar with that. In 23, it was changed to metabolic, which is called metabolic associated steatotic liver disease. That is it's a tongue full of names, but I think they wanted to sort of make sure the pathophysiology represent the name. So the alcohol-related fatty liver is, there is a history of regular alcohol intake over a period of time, more than recommended, and it causes direct damage to liver. And when you stop drinking, and certainly if in early stages, the liver can recover well. Whereas in metabolic liver disease, it is linked to the diet and also the fat deposition in the body. It also leads to people with the metabolic condition, diabetes, have increased incidence of fatty liver, physical inactivity. So these are the number of conditions that can cause a liver disease. In fact, one of the important things is this is the leading cause of liver disease in the world. It used to be number 3, but I think it is now overtaking even the alcohol-induced liver cell disease throughout the world, and the incidence is rapidly rising. Then we'll come back to that. So it would be good to know how the fatty liver is diagnosed. Most of the time, as I mentioned, the patients are asymptomatic. They don't know that they have got fatty liver. And it is picked up on when you have a routine blood test for a lot of reasons. For example, for insurance purpose, so you come with a different problem, they do a liver test. So they find the liver enzymes are slightly elevated. Or perhaps you have an ultrasound scan for another unrelated condition that can pick up the bright liver, which is due to fatty deposition with the ultrasonic waves that can pick up. And there are more specific tests nowadays available. Again, non-invasive, we've got a fibroscan that can also show the stiffness of the liver and the scarring, the very useful test. And the liver biopsy in general, we don't do it, but in cases where things are not very clear or where there's an overlapping condition, the liver biopsy can be useful as well. The diagnostic criteria, I think it's worth mentioning about it because it is a condition which is only recognized in late 80s, around 87, 88. Before that, people were not aware of it. So it is important to exclude the common causes of liver disease by the history taking. And generally, people know that people tend to underestimate how much they drink, and the rule of thumb is that you have to double or triple the amount that they normally admit that they are drinking. And we will do a full liver screen to make sure that it's not due to any other causes like either drug-induced or due to hepatitis or some genetic conditions. And then the histology, as I mentioned, is something which we don't do it now. So these are the factors that, I think I can't see the slides very well here. Yeah, so the risk factors, who gets the fatty liver disease? So first, obviously, people who carry too much weight, that is an important risk factor. And also it is to be said that you don't have to be overweight to have fatty liver. People with the normal body weight and the lean body mass also can have fatty liver. Particularly in South Asians, it's one of the risk factors. So you have to be aware of that as well. Type 2 diabetes or pre-diabetes, we know in the UK, over the age of 40, 1 in 10 people have got diabetes, and 90% of those diabetes are type 2 diabetes. And India is the capital of the diabetic world. And also they say that every other diabetic patient is Asians because it's so common among Asian population. And certainly the diet of high processed food and high sugar or fruit juices, another risk factor. We talked about the sedentary lifestyle, physical inactivity, cholesterol, triglycerides, and most importantly, the poor sleep and stress is also something that can lead to a fatty liver acid. We will come back to the mechanism of it because this all tie in with what we call a lifestyle medicine, which is another important thing that people are beginning to realize. Okay, it's not... Okay, let me see. Yeah, so I just also want to talk about one of Sir Arthur Clarke's theory, because when we were medical students in mid-80s, I'm a very proud product of Jaffna University, and Dr. Rajaratnam was one of our mentor and a teacher as well. So we have seen patients in those days, I'm talking about 70s and 80s, in the mid-60s, people present with liver failure or chronic liver disease. And generally, they are slightly overweight, they had diabetes, but we didn't know what was the cause of the liver disease. And we told them, or they are classified as cryptogenic liver cirrhosis, or idiopathic liver cirrhosis, which means we don't know the cause. When we talked about cryptogenic or idiopathic, that is the medical term that we use when we don't know the cause. So, but then we thought, generally most of them were female. So we thought, at that time, I think in Jaffna that alcohol intake of women is probably unheard of. But one of the sort of theory was perhaps they are secret drinkers. So because we didn't know, so we thought that is probably the leading cause of liver disease worldwide. But now we know, as I mentioned, the fatty liver problem being recognized in late 80s, and similar to hepatitis C, that is also was not picked up until mid-80s. So now we know those cryptogenic or liver cirrhosis, idiopathic liver cirrhosis, were due to burnt out fatty liver. 95% of those patients, we classified them as ketogenic cirrhosis, now turn out to be fatty liver. So it is important to be aware. The medicine is rapidly evolving. What we know now may not be necessarily true in 5 years' time. Like what Thiruvalluvar said, which means that you need to study thoroughly. You need to continuously question your knowledge and apply wisely. That's the important thing in medicine when it comes to, because one of the things, that is a good thing about medicine, because there are things we didn't know. Now the new science is able to tell us, what is happening. So there are 4 stages of liver, and I just want you to think as a spectrum of the stage 1 to stage 4. The important thing is stage 1 is just simple fat, where it is picked up. You have, as I mentioned, you have absolutely no symptoms, no pain, no discomfort, no lethargy. It was just picked up, and that is stage 1. There was fat in the liver, no inflammation, and it is fully reversible. Stage 2 is slightly inflamed liver due to fat deposition. That constitutes about 80 to 90% of the patients that we have. It is also introduced the concept of icebergs in medicine. We talk about concept of iceberg in medicine. You see only the tip of the iceberg at some point. For example, if you talk about the heart disease, when people develop heart attack at the age of 50 or 60, it doesn't develop overnight. The process of developing heart disease starts in their 20s and 30s. But when it reaches that point, and certainly we talked about when completely blocked or not significantly compromised, then you get heart attack and the chest pain. Similarly, we know about 80 to 90% of the people who have got fatty liver, they are in the community. They don't know they have got it because they are completely asymptomatic. The people who we see have got advanced liver disease. That is one of the problems that we have. So the important thing is to be aware of the risk factors, and certainly we need to be talking about for the lifestyle choices and other factors. So we talked about this one as well. So as I mentioned, it's a spectrum of conditions. When you have got the liver and it leads to cirrhosis, when people have established cirrhosis, that is a risk factor for a liver cancer as well. But remember that this process of from simple fat liver to leading to liver cirrhosis, it can take up to 10 to 20 years. So it doesn't develop overnight. So there is an ample opportunity for people to look at it and reverse the condition. That is why I think it is important to be aware of what is going on. So just to show you the histological picture, where you can see on the top part where there is a lot of fat globules in the liver cells, and the middle part is showing inflammation. This is histological, where we are looking under the microscope, about 500 times magnified view, and there's inflammation in the middle, and on the lower part it's showing the scarring of the liver when we call it liver cirrhosis. The good news is that it can reverse the condition. Unlike advanced heart disease or kidney disease or degenerative brain disease, the liver disease, if picked up in early stages, you can completely reverse it. So what is the advice that that people need to know in terms of lifestyle? So if you lose 5 to 10% of your weight loss, which is about 5 to 7 kilograms of your body weight, you can reduce the fat in the liver by 50%. If you exercise regularly, about 30 to 40 minutes walk or some lightweight lifting, whatever exercise you choose to do, if you do it regularly, even without losing weight, it does help to reduce the fat in the liver by improving a lot of other factors. We know it can reverse the diabetes, improve the high blood pressure and the heart disease, and also the fatty liver. And the results can be seen within 2 to 3 months. So we talked about the other chronic conditions, but unfortunately, what we do know is that the fatty liver causes significant metabolic stress. As a result, it also causes diseases of the other important organs. For example, in people with fatty liver, there's an increased risk of cardiovascular disease. And in fact, people now recognize the leading cause of death in people with fatty liver is heart disease, not the liver disease. We talked about type 2 diabetes, which is a vicious circle, because when you have got fatty liver, then the diabetic control become poor. Then you develop insulin resistance that lead to poor glycemic control and fat deposition. So it is a vicious circle. Diabetes type 2 is something that we need to be aware of. We talked about liver cancer. The good news is if we picked up early, it's completely reversible by just modifying the lifestyle. So we will talk about some of the things that we can do to try and help with this condition, because the important thing is that is the most important factor of this liver disease is not the alcohol. So as I mentioned, we're not talking about alcohol. The important thing is what we eat and how we live our life. Those are the two important risk factors for this metabolic associated steatotic liver condition. So we talked about the things that you need to cut down in our food, sugary drinks, fruit juices, ultra-processed snacks, and there is a high carbohydrate, refined carbohydrate diet, fast food, and excessive red meat. Those are the things that is a risk factor for developing fatty liver. And the other thing that on the right side, you can see the olive oil, avocado oil, and fish, nuts, seed, legumes, all those things are very useful. The only thing is that there is enough evidence to support this type of thing. So that is a consistent evidence to support how the diet improves everything. It improves the mental health, it improves your sleep pattern. And I think when it comes to the fat in the diet, it is the quality than the quantity that matters. So I just want to tell about what Thiruvalluvar said 2,000 years ago about the chapter in medicine. He said, "Marandana vendavam jakeki arundiyadu attadu poti uni." What he said was, if you eat when your previous food has fully digested and there is no need for any medicine. So the simple thing he said over 2,000 years ago. In fact, it's worth reading about this chapter in Medicine 95. There are about 10 Thirukural, and it's a very valuable, and he said about, and he also talked about the soothe, which is a harmful substance, about it. He doesn't mince his words about alcohol. And I think it's worth revisiting what he mentioned about 2,000 years ago. And in English, it said, no medicine is necessary for him who eats after assuring what he has already eaten. So we also know in Tamil, I think that probably attribute to Avvar, Alavukku Minjinal Amudam Nanju, that we know the food also can be a poison. The father of modern Western medicine, Hippocrates, also said, let the food be the medicine and the food be the food. So I think these things been recognized long time ago. And Japanese people also has got some ancient ideas now being recognized in the modern science. In Japanese proverb is harakuchibu, which means that you eat until you are 80% full, which is very difficult to know when you are 80% full. But the general rule of thumb is that you stop eating when you feel that you can eat a bit more. And that is when you feel that the body will be able to cope. And also remember the Kannadasan in 1974, he said, Pasivera ange matregal, pattiniyalingu yatregal. He said about the social inequality at that time. But now we know a lot of people in the Western countries are on weight control injection like Ozempic or Mounjaro. Now it has gone the other way. So it's interesting, how the social inequalities as a factor of medicine. So we talked about exercise is a very important factor. I mentioned about that you walk 30 to 40 minutes 5 times a week is useful, and also some resistant training if you're able to do. And being active helps a lot in terms of increasing the insulin sensitivity. So you don't need to have to go to gym to do the exercise. Yeah, this is one of the important things I find surprises most people, because we don't usually think sleep and stress are liver issues, but the evidence is now very clear. Poor sleep or disturbed sleep raises cortisol level. The cortisol level is a stress hormone that increases the insulin resistance, and that can lead to a fatty deposition. Similar to stress, chronic stress increases the cortisol level, insulin resistance, and that can lead to fatty liver. So I think the managing stress is important through mindfulness. I think what Siskandaraja and Arulanthi doing, it's a great thing. They are well ahead of the curve already, showing what is important in life. So I think it's not for the mental health, it is also good for liver medicine as well. So the sleep hygiene is an important factor. So I also want you to know that we get to the final summary. I want you to give something practical to take away. These are the 5 questions worth asking your doctor at your next appointment if you are worried about and if you think that you may have fatty liver. So you can ask this question: do I need a liver ultrasound or a blood test? And most people, most doctors would welcome that you're interested in your health, and that is an important factor. And also there is a FIB-4 score, which can be done by some of the blood test and the age. And I'm sure the GP would be able to advise you on that. And also talk about the weight loss and about the diabetes and the cholesterol. And then, so, these are the type of questions that I think you need to talk. And as I mentioned, the most doctors will welcome them. As I approach to the end, I want you to leave you with just 3 things. One is the fatty liver. It is common and silent. 1 in 4 people have it. Most feel nothing about it, and it can be treated if it identified early. It is reversible, as we talked about. There's no need for any medication or surgery. Just modifying the lifestyle. And then there are some medication. For example, we find the metformin is a very cheap drug, is useful. There's another drug being recommended in America, which is not available in the UK, called resmetirom, which is also they're using it. But the lifestyle, there are 6 pillars of lifestyle medicine. One is a proper balanced diet in moderation, and exercise, reducing the harmful substances, a good sleep hygiene, and social connection. That is probably what you all are doing in terms of having a meeting, and the mental well-being. If all those 6 pillars can be looked at, and the health can be very useful. So this is one of the poem a mother is singing to his a son who is perhaps involved in a lot of gaming and watching computer, not able to do. But what she says in Kalala Nadandu Kannara Tungi Vairara Chaput Manasara Chiricha Unakku no eppadi. So it's very useful. It touches all the points of lifestyle medicine that I talked about. I also want to end with some light note. We know yoga is very useful for lots of medical conditions, both physical and mental health. The type of yoga, which is an asanas yoga, which is you need patience, practice, and discipline. But the yoga that we are familiar is, unfortunately, this yoga. This also you need patience, practice, but in discipline. But on that note, I will stop there, and I'm very happy to answer any questions. And I think I find the most important part of this talk is the conversation that we have in the discussion time. And again, thank you for your time. I think we have stopped on time, I hope. Thank you very much.
Thank you. மிகவும் நன்றி டாக்டர் மதியழகன். அருமையான பேச்சு. நாங்கள் உங்களை பாராட்டியும் வாழ்த்தியும் ஒரு 30 செகண்ட்ஸுக்கு நாங்கள் கைதட்டி மகிழ்வோம். முதல் உடைய மிகவும் நன்றி. முதலாவதாக சீமிலிருந்து கண் குகணேசன் ஐயா, நீங்க பேசலாம்.
நன்றி ஐயா. இமைப்பொழுதும் என் நெஞ்சில் நீங்காதான் தாழ்வாழ்க. டாக்டர், உங்களது பேச்சு மிகவும் அருமையாக இருந்தது. நான் உங்களை வாழ்த்துகிறேன், வணங்குகிறேன், மகிழ்கின்றேன். உங்களுக்கு என்ன ஞாபகம் வருகிறதா தெரியவில்லை. அன்பழா என்று ஃப்ரெண்ட் தெரியும் தான், புவனேஸ்வர் மறந்துட்டீங்கள். பரவாயில்ல. என்னென்றால் கேள்வி என்னென்றா, நான் நேரடியாக நேரத்து கருதி கேள்விக்கு போறேன். ஒன்று என்னென்றா, நீங்கள் அந்த ஓரளவுக்கு சொல்லிட்டீங்கள். If you happen to be a pure vegetarian right throughout your life, still you have a risk of getting fatty life. That's ஒரு கேள்வி. The other one is a very general one. You were talking about Tiruvalluvar Tirukkural. There's another kural coming for doctors. Noi nadi, noi mudal nadi. I think you might have read that. NHS la noi mudal nadi also they do it or not?
Thank you, Kuganesan. And I remember you well. Sorry, we are all catching up with our age, okay. But we haven't seen recently. But thank you for the. So the vegetarian diet is good. Obviously, we know that people who are on vegetarian diet live longer, but unfortunately, it also contains high levels of carbohydrate and sugar. See, if you go to a temple, our priest, you can see. Unfortunately, that is how we tend to do. So the reason that South Asians are very high increased risk of diabetes because of our diet. So yes, I don't think the diet, vegetarian diet, though it is helpful for some other things, it comes back to the fact that whether we are having everything in moderation. So ideally, the micronutrient, that is the carbohydrate, fat, and the protein, should be around 35% each. So if anything goes above, then that is where we will develop problems. And thank you for bringing about the Tiruvalluvar Noinadi, because you're right. In fact, that is probably one of the other Tirukkural that I'm very, what Tiruvalluvar said 2000 years ago. Now, he said, before you treat the condition, you need to know what is causing it. You need to do the relevant test. You need to diagnose it properly, and then you treat. And he said 2005 years ago. But you said about do it in NHS. But I'm afraid, unfortunately, we are now living in a situation where people are being overdiagnosed, overtreated, over-investigated, over-intervention, which is a pandemic on its own because of the defensive medicine. I think it is important to have a real, because there are things that people can have. They are not going to change your lifestyle, but we are worried about unnecessarily. So the important thing is to have a conversation and the reassurance from the people so that we can avoid. So coming back to the lifestyle medicine, I think the 6 pillars were a proper, balanced nutrition in moderation, a good exercise, a good sleep hygiene, a social connection where you meet people, a mental health, and avoiding harmful substances. And Tirukkural, as I mentioned, Tiruvalluvar wrote about alcohol and these gambling very well. So that is what we need to look at, what we can do to try and, because it's interestingly, if you lose weight, if people who carry too much weight, they suffer from diabetes, high blood pressure, heart disease. They have got obstructive sleep apnea. They have got a problem with their sleep disorder. They've got fatty liver. So they've got 5 conditions, and you will need about 15 drugs to try and manage. And that's what happened. The polypharmacy is a huge problem now because we are giving medication for each and every condition. But if you lose weight, you will reverse everything. You will reverse your diabetes. You don't need treatment for high blood pressure. You don't need, your sleep pattern will improve, your fatty liver will improve. So just simple modification by losing weight, that you can reverse the majority of the condition that affects worldwide. Because the leading causes of death in the UK now is high blood pressure, diabetes, heart disease, obesity, dementia, and stroke. All those things are not due to genetic, they're due to our lifestyle. So I think the lifestyle modification is very important. Sorry, I took a long time because I think that's a very passionate about that. It's a topic that I feel very passionate about it. So I thought it is worth sort of emphasizing that point. Thank you.
Yeah. Thank you very much indeed. Thank you.
அடுத்ததாக டாக்டர் நவரட்னம் நீங்க பேசலாம். நன்றி.
எல்லோருக்கும் வணக்கம். தேங்க்யூ. ஆங்கிலத்தில் பேசினாலும் I can talk in Tamil or English. I must introduce myself to the speaker. I was a consultant here in this country from 1974. I studied in Colombo. I remember in 1962, Professor Ms. Yoganathan used to talk about fatty liver. What she said then is still true. And I used to take notes, and it was used by MD students those days. Anyway, and when when Jaffna Medical Group started, I used to go and lecture to the students then. Of course, Dr. Nagendra, Professor Sriharan, they were all there then. And now, coming to your speech today, it's a good speech. It's good for the population who are watching, but the number of people are watching today. It applies to the practicality of reducing liver problems and improving health. I have got one or two points to add. One is exercise is the best medicine to reduce fat in the body. Diabetics, when they take more insulin, the sugar may come down, but the sugar is converted into fat and it has to be deposited somewhere. And liver is one of the places where it goes. So diabetics, it's better to control what you eat and improve your exercise than use more insulin to reduce your blood sugar. One. Number two, taking cholesterol-reducing tablets is a mandatory thing for people who have had hypertension, ischemic heart disease, and whether they have high cholesterol or not. Now, atorvastatin or rosuvastatin is prescribed routinely, and the HDL cholesterol should be high and LDL must come down, even half the recommended range. The one thing you have not touched on, I thought I must say that. And so a lot of people, diabetics, are taking atorvastatin or rosuvastatin to keep their cholesterol under control. And thank you for your speech. Thank you.
I just, thank you. I appreciate your comments. But interesting, you mentioned about 1962, but the fatty liver disease did not come into the literature until 1988. We didn't know that fatty liver can cause cirrhosis. So that is a good point. If your consultant mentioned in 1962, and that is remarkable, because when I was a medical student in Jaffna Medical Faculty in Jaffna Hospital, I have come across 2 or 3 patients. We labeled them as cryptogenic liver cirrhosis. And if anyone, I would have thought Prof. Sriharan and Dr. Ranjit Dayalan would have picked it up. So I do believe that this condition didn't exist until, not that we didn't know it existed, we didn't know this was an entity until 1970 and 1987. But thank you.
நன்றி. அடுத்ததாக டாக்டர் சரஸ் சிவலோகநாதன் நீங்க பேசணும்.
Good evening, everyone. Good to see a doctor from Jaffna Medical School. உங்களோட குரு இருக்கிறார் இங்க வந்து, Dr. Dayalan. Anyway, thank you for your excellent talk. Valam concise தந்தீர்கள் எனக்கு to remind me, because I was an old day psychiatrist, so I kept up with medicine as well. But the problem, but in this forum, they're like all you mentioned about lifestyle is being practiced. Mr. and Mrs. Srikanda Raja have seen to it that people have regular exercise. And also they talk meditation with rest, sleep, everything of what you have said. But one has to adhere to these things. As you said, diabetes, of course, is quite common amongst the Asians and Africans, you know. Only thing with this, what you have said today about liver problems, I was just following the steps you said. When it comes to inflammation even, we don't really have any symptoms, do we? That is the problem. So if you go and ask but they do the ALT, of course, every year when they do an annual blood test, they do that. Nowadays, we can't go and just ask, you know, can you do this for us? And even a scan. That's the problem. But of course, I don't think any of us in this forum has cirrhosis, but maybe we have fatty liver and we don't know. But as you say, if we keep our weight down, regular exercise, good sleep, and balanced diet, as we all know in this forum, I suppose there is, we can, and also, you know, I think we are being monitored for diabetes and cholesterol, blood pressure, now regularly monitored by GPs as well. That's another thing. And people do take appropriate medication. And weight loss, I mean, regular exercise, as you say, is very important. And again, that is being done in this forum as well. Anyway, thank you very much for coming and reminding us of this entity, you know, which is not generally talked about. Thank you.
Thank you.
Thank you. Next, Rajesh Bala, Master from North London. Thank you.
Good evening. Dr. Mathyalakan is a very good subject to talk because I'm in the first health promotion officer for Asian community in the 90s. I've done many researches because 1991 census shows that Asian community have high rates of diabetes and heart problem and the depression. So I was a researcher. What I found in 1993 is that the lifestyle more than any other subject, such as alcohol or something like that. The reason was because of the Asian community, high proportion Asian community came in 1972 from Uganda in one go, just over 100,000 Asian came. So the 1991 census, where they found out them health problem. Like that, our Asian community, they came in a higher level in 1983. I was a person set up a Tamil refugee organization, housing association, human rights organization. So again, it's the same problem. Part of the reason, high number of people in one go, Asian community in the 72 from Uganda, 82 after problem. So still exists. But our community, what I observe, I have written medical books because the doctors in Sri Lanka asked me to write because they said you are a medical anthropologist and also very, very interested in human rights. So I wrote 2 medical books for Tamil community. But my observation for the last 3 generations in England from 1970 onwards, the excessive food is not good. Kalyana Vudu, Andavudu, Indavudu, the Asian community is so bad with the sweet intake, carbohydrate intake. And Lanthalamura, not now, 83 my observation. When I visited the Alcoholic Center in West London, hell of a lot of Sri Lankan boys. The part of the reason, disturbed lifestyle and things like that. Now, after 3 generations of Asian community, they are getting much better. But still, the excessive carbohydrate and sugar level, lack of exercise, they don't go anywhere. One of my recommendations was to the government in 1993 to establish, fund the women organization for exercise and things. So loads of women organizations set up for exercise and dance classes. And Our community is doing it. Our girls are doing it. Our older people are doing it. But people like you all, not only coming here, please, 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 community centers, give them some advice, because there are loads of community centers we have. I done the best I can for our community. I'm an old lady. From 1972 up to now, never stop writing about articles on health or community issues or something like that. So thank you. It's a brilliant subject. My grandfather was an Ayurvedic doctor, not Ayurvedic doctor, நாட்டு வைத்தியர் என்று சொல்லப்பட்டவர். So the word அடிக்கடி சொல்லுவாங்க, 5 காஸ்மிக் பவர் இருக்கிற மாதிரி, பிரபஞ்சம் இருக்கிற மாதிரி எங்களோட உடல்லையும் brain, heart, lung, kidney, the liver. The liver is a mother. If you don't look after the liver, இந்த வார்த்தை தமிழ்ல சொல்ல, இங்கிலீஷ்ல சொல்ல இல்லவே, தமிழ்ல நாங்கள் வளர்க்க எங்களுக்கு சின்ன வயதில் சொல்லி தந்தது. எங்களோட குடும்பத்தில் வெரி வெரி ஹெல்த்தி கான்சியஸ் பீப்புள் எங்களோட குடும்பம். நான் இன்றைக்கு I don't eat evening meal. About 25 years now, I don't eat evening meal. So I'm healthy, I'm active, still writing books, I'm giving talk, still. Please, Dr. Dayalan, do some work with the community. Thank you very much. God bless you. இந்த தளத்துக்கு நான் காலையிலையும் நான் நன்றி சொன்னேன். நான் மிஸ்டர் கிருஷ்ண ஸ்ரீகந்தராஜாவும் அருந்ததியும் this gift, because எவ்வளவு பேர் வர்றோம், இந்த knowledge and the message have to go to the community. Thank you.
Thank you very much. Thank you, Dr. Shanti Parameswaran from New Modern. Thank you.
எல்லோருக்கும் வணக்கம். Greetings to all. Thank you very much, Dr. Madhi Master, that you brought an important subject today and made us all made us all aware of this subject. I think everybody has said and asked questions. Just one or two questions that I have come to my mind is, as it has been said, diabetes is very common among Asians. My father had diabetes, his whole family had diabetes, and unfortunately, all his 5 children, including me, have diabetes. And you did mention something about genetic factor there. Is there a genetic factor influencing diabetes, or is that the lifestyle that we all share?
No, I think it's a good question, because I hope it is a type 1 diabetes or type 2 diabetes.
Type 2 diabetes.
Yeah. So some people do develop very strong family history. They do develop diabetes around 30s and 40s. It looks like probably that is, and there is definitely a genetic link. But majority of the type 2 diabetes are not related to genetics, but there are a minority of people do. So I don't think you, obviously you can't blame your parents for the genetics, but it's one of those things. As long as that, I don't think it's the diet control, but it's true. I'm not familiar with the gene expression, but I'm sure with your history of very strong family history, your parents and all your 5 siblings having diabetes, there's no doubt it is linked to the genetics. But it is well known that certain diabetic do runs in family.
Thank you very much for that. It makes me a little bit easier when I go back to eating the chocolate from the fridge. I will think about that. Thank you very much. The other thing was, among Asians, particularly among men, but I'm not excluding women, they tend to have a big tummy. Is there a correlation between that and what you said today?
Yeah, no, I think the central obesity or adiposity is one of the very high risk factor for all the condition I mentioned about. We talk about a metabolic condition. The central obesity is a huge risk factor. Why we develop central obesity, I think that is probably more related to the genetics and the diet as well. But it's interesting is not only the liver disease, and if you look at, I'm sure Dr. Rajaratnam will tell, we have a very narrow coronaries as well. People will say, compared to the Europeans, our coronary arteries are narrow and also quite difficult when it comes to having an angioplasty, because people say you can look at the angiogram and they will say it probably belongs to the Asian group. But unfortunately, there are a lot of other strong points that Asian do have, and there are some conditions which predispose us to certain medical condition. But majority of those, I feel that we can at least reverse it or reduce it by having this sort of the lifestyle modification. Very simple thing. I'm
Thank
sure,
you very
Dr.
much.
Allen, I'm not sure whether you have got any comments to make on this about the angiographic finding, which I remember someone said, but I do feel it is probably true.
It is true, yes. That's because we Asians have a lower weight risk of abdominal obesity and fatty liver. That is probably genetic, and also they have mentioned we have smaller pancreas than Caucasians.
Right. Thank you. And lovely to see you, Ranjana Allen, to see you. Welcome. And I think today I learned something that I didn't.
Antimasa, your voice, we can't hear your voice.
Right. So must confess that I didn't know about asking for the what you said, the fibrosis index 4 score. I didn't know about that. I knew about the ALT, but I didn't know that. So thank you for making my mind learn something new today. So something I will ask my doctor when I next go for my annual diabetic test. Thank you very much, and thank you very much for a very concise, very explicit, and in the time that you were given, you made us all increase our awareness for this condition. Thank you, and I hope to see you again on another topic. Thank you.
That's very kind. Thank you. I appreciate your comments. Thank you.
Thank you. இன்னொரு 15 நிமிடங்கள் இருக்கின்றது. எல்லோரும் கேள்விகளை கேளுங்க தயவு செய்து. நன்றி.
Sihirda Mohanadas from Wembley. நீங்க பேசுங்க.
எல்லோருக்கும் எனது அன்பான வணக்கம். Actually, Dr. Dayalan's speech was very good, but unfortunately, I joined a bit late and I couldn't hear the whole thing. So
மதியழகன் அவர் மாறி சொல்றீங்க.
Oh, sorry, Dr. Excuse me, please. I'm very sorry. It's Dr. Madhyalakan. Right. Yeah, actually, I need a copy of the today's program. If you could send me, please. And
Definitely.
Thank you very much. Thank you very much. And also, in fact, this diabetes has gone up tremendously after 1960s. Up to 1960s, in sports, people who have done sports were given glucose. And immediately, everyone is given glucose. And that was a practice. Later, sugar, forms of sugar has increased, and that became a problem to most of us. And most of us have diabetes nowadays. And I think that is because of the scientific advancement in producing sugar in different forms, and wrong form of sugar is given to the people to consume. That is in the market. What do you think about it?
Yeah, I think you're right. The incidence of obesity has increased tremendously, and in UK, 1 in 3 people carry more weight than what is recommended. And also, we also know that a lot of people are on weight reducing diet or some program. Despite that, it's said that every decade our hip size is increasing every inch, every 10 years. So certainly the diet seems to be not working. So, but you are right about the what now they talk about is the gut microbiome. That is another important topic that people talk about, how we can control and reverse. For example, in New Zealand, they are now for obesity, one of the treatment they are implementing is the microbial transplant, because if you change your gut microbiome, if your gut microbiome has more diversity and healthy bacteria, that also can reverse diabetes and reduce all the other factors. So there's so many things now is coming up, but you were right, in the past, people didn't have so much of ultra-processed food, refined carbohydrate. People ate more grain, people ate more fruits, people ate, we didn't have a fridge growing up in Jaffna. We have to have a daily food, everything fresh. So there are a lot of things has happened socially. Certainly that has helped, but it also has got its own problem. But it is a disease of it is a modern epidemic. And, how much the percentage of children having obesity and type 2 diabetes and fatty liver is very high. And in Europe, Britain probably has the highest incidence of childhood obesity as well. And unfortunately, it happens in the poor socioeconomic group because of the social inequality, and able to access good quality food in the price is another factor. So there are so many things. And we know that the fizzy drink that we have has about 5 to 6 teaspoons of sugar. So unfortunately, it's all about making money. They make you feel more addicted, so that people add something into it. So it's all gone to the other side. But as a society, as a government, though they are doing things, but I don't think it's working.
அடுத்ததா டாக்டர் ஜெகநாதன் பேசுங்க.
நன்றி. அருமையான பேச்சு. நான் கேள்விக்கு முதல் 2 கருத்து சொல்லணும். லெட்ஸ் பேர்ன் இட் அப்னு கேள்விப்பட இல்லையா? அதான் சீக்ரெட். இஃப் யூ ஈட் மோர், பேர்ன் இட் அப். அல்லது இந்த கேலரிஸை குறைக்க சொல்கிறார்கள். டயபெட்டிஸ் சொன்னா 1000 இல்லை 900 கேலரிஸ் சொல்கிறார்கள். என்ன நடக்குதுன்னு சொன்னா, சிலர் ஓடி ஓடி உழைக்க வேண்டி இருக்குது, சிலர் உழைச்சு உண்டதை ஓடி ஓடி இழக்க வேண்டி இருக்கு. பாத்தீங்களா? அப்படித்தான் உலகம். எனிவே, எனக்கு 2 கேள்வி இருக்கின்றது. முதலாவது கேள்வி இல்லை, இந்த சிரோசிஸ் என்பது, நானும் ஒரு டாக்டர் தான், சிரோசிஸ் என்பது ஒரு ஸ்காரிங் என்று தான் சொல்லுவார்கள். ஆல்கஹால் ஒரு டாக்ஸின், ஆனா ஃபேட்டி லிவர் டாக்ஸின் இல்லை, ஏதாவது ப்ரெஷர் ஆண்டா என்னன்னா கார்டியாக் சிரோசிஸ் இருக்குது. ஸோ இன் அ வே உங்களுக்கு பேக் ப்ரெஷர் லிவருக்கு எக்ஸசிவ் பிளட் இருந்தாலும் சிரோசிஸ் வருது. பாத்தீங்களா? அதுதான் அந்த கேள்வி. பிகாஸ் இந்த ஃபேட்டி லிவர் இஸ் காசிங் கம் டு ப்ரெஷர் எஃபெக்டா. மற்றது அடுத்த கேள்வி இந்த மெட்டாபாலிக் சிண்ட்ரோம் இஸ் காட் டிஃப்ரெண்ட் கிரைட்டீரியா. ஆனா லாங் டேர்ம், நான் ஒரு சைக்காட்ரிஸ்ட், எனக்கு கூட பழக்கம். லாங் டேர்ம் சைக்கோட்ரோபிக் மெடிக்கேஷன் எடுத்து எல்லாருக்கும் ஃபேட்டி லிவர் வருது. Unavoidably you have to treat the symptoms. அது மாதிரி மற்ற கண்டிஷன்ஸ்லயும் லாங் டேர்ம் மெடிகேஷன்ஸ் வரலாமாக்குமா fatty liver?
Yeah, no, thank you. I think what happens with fatty liver is the fat can cause inflammation around the liver cells. So if you look at alcohol, the mechanism alcohol leads to liver cirrhosis is also due to fatty liver. But the interesting part is the fatty liver caused by the excess alcohol and the fatty liver caused by just MASLD, metabolic associated steatosis, look similar. That is why in the past that we had to do liver biopsy to differentiate between those two. So the mechanism is the same. More than that, and also alcohol has a direct toxic effect on the liver as well. You mentioned about cardiac cirrhosis, which is true. Whether that is because of increased blood flow to the liver, I think it is due to the back pressure. When the heart fails, it also causes right side heart failure. And as a result, there's a lot of pooling and increased pressure in the portal circulation, and that leads to the scarring. So yes, it is very true, though it is a term that we use. That is, we see it it's not that common, but we still see this cardiac cirrhosis is something still exists. So the mechanism is different, not due to the fat deposition leading to necrosis and inflammation and scarring. It is probably due to the increased pressure in the portal circulation leading to portal hypertension, and that lead to the impairment of the liver problem.
Okay, thank you. Nandri.
Thank you. Next, சுகேந்திர தர்மகுமார், நீங்க உங்களோட கருத்தையும் சொல்லி முடிவு chat box 2 இருக்கு, அதையும் இருக்க வாய்ச்சி விடுங்க. வேலுமா உங்களுக்கு?
Yeah.
Thank you.
Greetings to everyone. Mathyalakan, it was very informative speech. I have one question. If you go for liver function blood test, is that will show your blood fatty liver as well? I just want to ask you that question.
Okay. I think it's a good point because we know that the liver function test can remain completely normal, deceptively normal, where you may have a very advanced liver disease. So the transaminase level we talk about, ALT and AST and alkaline phosphatase, are not something that you can rely on completely. But what we do know, if you have got risk factors for fatty liver, those enzymes tend to have a slightly raised level. Just because your enzyme is normal doesn't exclude fatty liver. Then that's what we talked about. Ultrasound is a very good test. It picks up that bright substance, the fat in the liver is a very good test to show whether you've got fatty liver. And then if there are risk factors where you have got probably, if you have got diabetes, and if the ultrasounds show, they also will be able to grade it on the ultrasound, whether it is just a mild hepatic steatosis or whether it is moderate. And then we can go for the fibroscan. The fibroscan will give you the resilience of the liver and the scarring and the rigidity. So there's a score that they will come up with, and that will tell us whether you have got any degree of problem with the fatty liver. And the FIB-4 score, which is done by calculating the age, ALT, AST, and the platelet count. There's a formula they can use. So there are a lot of things they will do, but I wouldn't sort of say the normal liver disease exclude fatty liver. No, it is probably true for majority of the time. But if you think that you have got risk factors and if you are worried about, then an ultrasound would be not a bad idea, or a FIB-4 score also would be useful.
Okay. Thank you. Thank you.
இனி ஒருவரும் கை போடாதீங்கோ என்னடா 7 நிமிஷம் இருக்குது ஒருத்தரும் கை போட வேண்டாம்.
I'll read the chat box.
Yeah.
Deva and Shantini, Meena, Shantini Rajasuriya and Meena Ambike Silvaraja thanked for your speech. And Kalevani, Germany, very nice explanation, doctor. Thank you very much. Dayalan to everyone. Very informative and useful talk. I like all the Tirukural you mentioned. Proud about you. Thank you, Dayal. Thanks, Dayalan. Sumadhi Sinnappan. Thank you very much, Master, for the session. Jnana Yogaraja. Thank you, Mr. Madhi, for your informative and educational speech. Ranjit Dayalan. Thank you so much for the excellent informative presentation on this important topic. You are not only the best product of Jaffna Medical Faculty, best examiner of Royal College of Physicians, best teacher and presenter, all the best. Jaya Gauri Sodilingam. Thank you, Dr. Madhi. It's very good, excellent speech about the health and fatty liver and other sickness. Sabesan, yes. Thank you, Dr. Madhi. Adi Anna, for your informative and engaging talk on fatty liver disease and its prevention. Your clear explanation and practical advice on maintaining a healthy lifestyle, proper diet, and regular exercise were very insightful and valuable. We truly appreciate the time and effort you took to raise awareness about this important health issue. Kala Mahalingam, Canada. Thanks your expert valuable information about sickness. Absolutely great. Congratulations, Master. God bless you and your family. Master, come again. Ram, Dr. Mathyalakan, can type 2 diabetes reverse through diet and exercise?
Can I answer that question? So thank you for all those very nice comments. I appreciate it. That's very good to feel that appreciated. Thank you. And I enjoyed preparing for this talk, and so I also learned a lot too about Tirukkural and everything else. So coming back to Ram's question, can exercise reverse type 2 diabetes? Yes, I think, as I mentioned, that the diet and the exercise can reverse not only type 2 diabetes, and there's a lots of data on that. In fact, a lot of data is done in UK as well. And not only it reverses the diabetes, it improves your blood pressure, it improves your heart disease, reduce the risk factors, improve your sleep pattern. So those are the two, because the diet, as I mentioned, the gut microbiome becoming a major important factor, because that's probably one of the most important discovery of late in the modern medicine. Now they say the 3-pound microbiome that we carry in our bowel is probably more important than every single gene that we have, because that controls your mood, that controls your sleep, that controls your diet, that controls how you are. So I think by adapting a good diet and reducing weight, not only those conditions will improve, but also improve the mental well-being. Because now people talk about psychobiotics. We know about prebiotics, probiotics to try and improve your gut flora. Now there are diet that reduces the inflammation, improve the release of oxytocin and those serotonin, those happy hormones from the brain, certain diet. That is how the exercise also does. So there's no doubt the exercise, just simple lifestyle measures will be very helpful. And I think that is what you're right. We should be promoting those things on a regular community-based level. And I do feel that every temple should have a gym next to that, because you go to temple, a lot of us do, and certainly it improves the spiritual health. But to improve the physical health, I think we should have a gym next to that, so we could have both the holistic health care. So that is what we should be doing.
Thank you. Very good idea. Thank you very much. Radhe Master, நீங்க பேசுங்க.
அனைவருக்கும் வணக்கம். Dr. Mathyalakan, you have given us an excellent presentation on fatty liver. I had just got one question. I think you have already answered part of the question to Sugendra Dharmakumar, but I still want to make sure that I got it right. The question is, if you have a normal ALT, but if you have a raised cholesterol and a triglyceride, what does that mean?
I think obviously,
sorry.
I think the cholesterol being high is not necessarily related to liver disease, but what we know is people who have got high cholesterol and high triglycerides do have an increased tendency to develop fatty liver. So it's a separate entity. So you can have a normal liver, but your cholesterol level could be high due to number of things. But what we do know is if you tend to have a cholesterol being high for a long period of time, that you have a risk, that's one of the risk factors for developing fatty liver.
Okay. What about intermittent fasting? Does intermittent fasting help?
I think, people do say that people lose weight. What is interesting is whether you are able to maintain that intermittent fasting and keep your body weight to below what is recommended. That is the problem, because as I mentioned, a lot of us are on a diet in Britain, but I don't think, if you look at overall, that the obesity level is increasing. So the diet, whatever we do, seems to be not working very well. Yes, I think in some people, they manage to lose weight, which is great. Whether they're able to maintain long term, that I haven't seen any evidence. But certainly, it's been recommended as one way of losing weight.
When you are fasting, that means your fatty acids are working, aren't they? Because so that means, can your cholesterol go up? It's a bit, I don't seem to get that quite rightly, because.
No, but you're right. When you're fasting, that you would expect there will be a breakdown of storage and those things. But the important thing is that the level of cholesterol, there are different components of cholesterol. There's a good cholesterol, HDL, there is a bad cholesterol, LDL, and the triglycerides. And that if the liver is functioning well, and all those, the bad cholesterol will be mopped up and that can be cleared, and the good cholesterol remain high. But that is one of the things that we do feel that the Atkinson diet, where people avoid complete loss of, there's no carbohydrate, people were put on very high fat and the high protein diet, they lost weight, but that lead to a lot of problems. They put a lot of stress on the liver and a lot of stress on the kidneys and a lot of stress on the, because it is not a natural way of losing weight, because we as humans have got to have a balanced diet with protein, carbohydrate, and fat in the right proportion. So by overdoing it one or the other, there will bound to be some metabolic consequences.
Thank you very much. Thank you.
Thank you very much. நான் சில அறிவித்துல சொன்ன பிறகு பஞ்சாட்சரம் மாஸ்டர் ரெடி ஆகுங்க. நாளைக்கு காலமே 8:45 AM எங்களுடைய செஷன் தொடங்குறது. 9 மணிக்கு சேர் எக்ஸசைஸ் நடைபெற இருக்கிறது. இன்று டாக்டர் மதியனுடைய பேச்சை கேட்ட பிறகு கூடுதல் பேர் கலந்து கொள்வார்கள் என்று எதிர்பார்க்கிறேன். நாளைக்கு 9 o'clock சேர் எக்ஸசைஸ். ஜெகநாதன் உங்களுக்கு ஒரு நாளும் காண்றையில் நாளைக்கு வேறுங்க வரும். அடுத்தது 10 மணிக்கு தனி மனித அமைதிக்கும் உலக அமைதிக்குமான தியானம். இது நீங்கள் தியானம் செய்தாலும் உங்களுக்கு ஸ்ட்ரெஸ் ஃப்ரீ லைஃப் வரும். அது எவிடன்ஸ். மற்றது நாங்கள் செய்கிற தியானம் NHSல சேம் திங், அதை என்கரேஜ் பண்ணும்படி சொல்லுகிறார்கள். NHSல நீங்கள் போய் செக் பண்ணி பார்க்கலாம். இந்த 11 மணிக்கு பிரதீப் விஜயுடைய இன்டர்நேஷனல் மெடிடேஷன் கோச் அருமையான கொஸ்டின் அண்ட் ஆன்சர் செஷன் இருக்கின்றது. இந்த நாளைக்கு 7:30 மணிக்கு குமார் புனிதவேல் அவர்கள் கனடாவிலிருந்து தமிழர் பாரம்பரியமும் பண்பாடும் என்ற தலைப்பில் பேச வருகிறார். நன்றி, வணக்கம். இப்பொழுது பஞ்சாட்சர மாஸ்டர் பேசுங்க.
எல்லோருக்கும் வணக்கம். முதலில் டாக்டர் மதியழகனுக்கும் நன்றியை சொல்லி, தயாளன் அவர்களுக்கும் நன்றியை சொல்லி, கணக்க இருக்கிறது நான் நேரம் கருதி கேள்வியை கேட்கிறேன். அதாவது ஜோண்டிஸ் வந்தவருக்கு லிவர் ப்ராப்ளம் வருமென்று இருக்கு என்று கேள்விப்பட்டிருக்கிறேன். அது இந்த ஃபேட் டிசீஸோட லிவர் ப்ராப்ளமோ, மற்றது இந்த ஃபேட் லிவர் வந்தால் கிளீன்சிங் த பிளட்டாலே அஃபெக்டட் ஆகுமோ, என்ன பேடா வரும் என்றதை சொல்ல முடியுமா ஐயா?
Okay. So thank you. But jaundice, but the liver disease there are a number of conditions can cause liver disease. If you are a child or growing up, you can develop hepatitis A or hepatitis C now. And those are self-limiting. They don't lead to any chronic diseases. So just like having a temperature or chest infection or just have a viral infection, you get better with no permanent sequelae. So hepatitis A is the commonest, and so there will be jaundice, but it doesn't affect the liver at all. They will completely fully recover. But if they develop hepatitis B and C, for example, people who shared needles in certain countries, people who had blood transfusion, who perhaps were not properly screened, or sometimes hepatitis B can come from the mother to the baby. Those things, if they're jaundiced, and those viruses tend to persist in the blood, and they can have a chronic liver disease, jaundice. And then the other common leading cause of liver disease is alcohol. If people do drink heavily, and that, as I mentioned, that is still the commonest. The fatty liver hasn't overtaken it, but it is rapidly rising. So those people who develop jaundice due to alcohol, due to two things. One is, if they drink very heavily, that can cause jaundice, and maybe they can get better. But if they develop jaundice due to progression of liver disease and cirrhosis, which means that their prognosis is very bad, and very often we find that they will continue to have problems and their lifespan is quite limited if they develop that level of jaundice and cirrhosis, and there are so many things can happen. So that is the causes of liver disease. Jaundice can lead to a number of things. There's another thing called very benign condition that is also not uncommon, called Gilbert's disease, where people can become jaundiced when they are fasting, when they're having an infection, and they will get better. So that is a Gilbert. That is also not uncommon. So just because they had jaundice doesn't mean they have got liver disease. And also gallstones is the other thing. As you get older, a lot of people do develop gallstone-related infection, and that can cause jaundice. When you treat them either with removing the gallbladder or some other procedures we can do endoscopically, they will get better. So jaundice alone doesn't mean that you have got chronic liver disease. That's first thing. And the second question, you can...
Fatty liver, cleansing the blood.
Right. Okay. So fatty liver, how does that affect the rest of the organ? Is because we talked about having a grease building up in the kitchen pipe. So when it is early stages, then the blood flow can happen. When it is developed over a period of time and the narrowing tend to get worse, as a result, then the function fails. When it is completely blocked and the liver fails. So I think that is the mechanism. That is the analogy we talked about, similar to coronary heart disease. Coronary artery also, if you have narrowing, if it is able to compensate, but when the narrowing becomes very critical or due to the plaque rupture, it completely obstructs, then you develop heart attack. So it's a similar mechanism. So fatty liver tend to cause inflammation of the liver cells, leading to scarring, leading to then progressing to fibrosis. But as I mentioned, from the early stage of fatty liver to develop liver cirrhosis, it takes about 10 to 20 years. It doesn't develop overnight. So it's a good opportunity there for people to reverse the fatty liver by adapting simple life measures. We use metformin a lot in people who are pre-diabetic. There's good evidence for that. And then all the other things like, Siskandaraja and Arulanandi doing this meditation and social connection and mental resilience and mindfulness, they're all very helpful items to sort of consider.
Thank you very much. Thank you.
Thank you very much. அடுத்ததாக டாக்டர் நவரட்னம் நீங்க பேசலாம். நன்றி.
அன்மியூட் பண்ணுங்க. ஒரு நிமிடம் தயவு செய்து பேசுங்க. அன்மியூட் பண்ண இல்லை, அன்மியூட் பண்ணுங்க டாக்டர்.
Thank you for letting me come back. I'm sorry that people of my stage in life are not here. But in 1962, Professor Yoganathan was talking about alcoholic liver disease, and she touched on fatty liver then. In fact, you don't need ultrasound to diagnose. We used to look at electron microscope those days and see liver cells in practice. And that is how I knew about fatty liver then. Later on, of course, knowledge improves and tests improve. And I've been a teacher at Royal Free Medical School. I taught medical students. I also was examiner. And I am able to